dental implants are a long-term solution for replacing missing teeth. They are designed to be durable and, with proper care, can last many years. Research suggests that dental implants can last 25 years or more. But this duration is influenced by several factors. Regular brushing and flossing play a crucial role in maintaining implant health. Poor oral hygiene can lead to peri-implantitis, a condition similar to gum disease, which can cause implant failure. Smoking significantly reduces the success rate of implants due to its impact on oral health. Similarly, conditions like diabetes, if not well controlled, can affect healing and implant longevity. Adequate bone density is essential for implant stability. Conditions like osteoporosis may affect this, potentially reducing the implant's lifespan. Precision in implant placement is critical. Misalignment can cause undue stress on the implant, affecting its longevity. The skill and experience of the dental surgeon play a significant role. A higher success rate is often observed with experienced dentists. The material and design of the implant can impact its durability. Titanium implants, for instance, have shown high success rates due to their strength and compatibility with body tissues. Routine visits to the dentist for checkups and cleanings are crucial. In the initial period post-surgery, avoiding hard foods can prevent undue stress on the implant. Addressing any discomfort, swelling, or other issues promptly can prevent complications. While these factors significantly influence the lifespan of dental implants, advancements in dental technology and techniques continue to improve their success rates. It is important for patients to discuss their specific conditions and habits with their dental professional to understand how these might impact the longevity of their dental implants.